Hello, and welcome to our channel. In this comprehensive video, we dive deep into challenging nursing questions related to musculoskeletal system, tailored for both NCLEX and Prometric exams. Join us to enhance your knowledge and critical thinking skills as we provide detailed answers and thorough rationales to help you succeed in your nursing career. Whether you're a student preparing for exams or a healthcare professional seeking to strengthen your expertise, this video will be an invaluable resource. Let's started. Question 1. A client with osteoporosis is prescribed alendronate, Fosamax. Which nursing intervention is a priority when administering this medication? A. Encourage the client to increase calcium intake. B. Instruct the client to take the medication with a full glass of water. C. Monitor the client for signs of hypercalcemia. D. Advise the client to avoid weight-bearing activities. Answer 1. B. Instruct the client to take the medication with a full glass of water. Rationale. Alendronate, Fosamax, is a bisphosphonate used to treat osteoporosis. It should be taken in the morning on an empty stomach with a full glass of water, followed by remaining upright for at least 30 minutes to prevent esophageal irritation and optimize absorption. Question 2. A nurse is caring for a client with a fracture of the right femur. Which assessment finding requires immediate intervention? A. Capillary refill of less than 3 seconds in the toes of the affected leg. B. Complaints of numbness and tingling in the right foot. C. Bruising and swelling along the right thigh. D. Pain rated at 7 out of 10 with movement of the right leg. Answer 2. B. Complaints of numbness and tingling in the right foot. Rationale. Complaints of numbness and tingling in the foot of the affected leg could indicate neurovascular compromise, such as compartment syndrome, which requires immediate intervention to prevent further tissue damage. Question 3. A client with rheumatoid arthritis, RA, is prescribed methotrexate. Which laboratory test should the nurse monitor closely during therapy? A. Serum sodium level. B. Serum potassium level. C. Liver function tests. D. Serum creatinine level. Answer 3. C. Liver function tests. Rationale. Methotrexate is known to cause hepatotoxicity. Therefore, it is essential to monitor liver function tests, such as alanine aminotransferase, ALT, aspartate aminotransferase, AST, and bilirubin levels, regularly during therapy to detect any signs of liver damage. Question 4. A client is admitted with a suspected hip fracture following a fall. Which nursing intervention is a priority in the immediate post-fall period? A. Assess for the presence of pedal pulses. B. Elevate the affected leg to reduce swelling. C. Apply ice packs to the hip area. D. Immobilize the affected leg. Answer 4. D. Immobilize the affected leg. Rationale. In suspected hip fractures, it is crucial to immobilize the affected leg to prevent further injury and minimize pain. Immobilization also helps maintain proper alignment and stability of the fracture site until definitive treatment can be provided. Question 5. A client with osteoarthritis, OA, is receiving acetaminophen, Tylenol, for pain management. Which statement by the client indicates a need for further education? A. I should avoid taking more than the prescribed dose of acetaminophen. B. I can continue drinking alcohol while taking acetaminophen. C. If I experience any signs of liver problems, I should contact my healthcare provider. D. Taking acetaminophen regularly can help reduce inflammation in my joints. Answer 5. B. I can continue drinking alcohol while taking acetaminophen. Rationale. Alcohol consumption while taking acetaminophen can increase the risk of liver damage. Clients should be advised to avoid alcohol or limit its consumption while taking acetaminophen to minimize this risk. Therefore, the client's statement indicating they can continue drinking alcohol while taking acetaminophen requires further education. Question 6. A client is admitted with a suspected rotator cuff tear. Which assessment finding is characteristic of this injury? A. Limited range of motion and pain with internal rotation of the shoulder. B. Swelling and warmth over the anterior knee. C. Crepitus and pain with extension of the elbow. D. Muscle weakness and atrophy in the lower leg. Answer 6. A. Limited range of motion and pain with internal rotation of the shoulder. Rationale. A rotator cuff tear commonly presents with limited range of motion and pain, particularly with activities involving internal rotation of the shoulder. Other symptoms may include weakness and difficulty lifting the arm. Question 7. A client with a history of osteoporosis is prescribed a bisphosphonate. What is the primary therapeutic effect of bisphosphonates? A. Stimulate bone formation. B. Increase calcium absorption. C. Inhibit bone resorption. D. Enhance muscle strength. Answer 7. C. Inhibit bone resorption. Rationale. Bisphosphonates work by inhibiting osteoclast-mediated bone resorption, thereby preserving bone density and reducing the risk of fractures in conditions such as osteoporosis. Question 8. A client with a suspected scaphoid fracture undergoes diagnostic testing. Which imaging modality is most commonly used to confirm a scaphoid fracture? A. MRI, magnetic resonance imaging. B. CT, computed tomography, scan. C. X-ray, radiography. D. Bone scan. Answer 8. C. X-ray, radiography. Rationale. X-ray is the most commonly used imaging modality to confirm a scaphoid fracture. However, in some cases, a scaphoid fracture may not be immediately visible on X-ray and may require additional imaging or follow-up X-rays. Question 9. A client with a spinal cord injury at the cervical level is admitted to the emergency department. Which priority intervention should the nurse implement to prevent complications? A. Monitor for signs of autonomic dysreflexia. B. Perform passive range of motion exercises. C. Elevate the head of the bed to 45 degrees. D. Apply a heating pad to the affected area. Answer 9. A. Monitor for signs of autonomic dysreflexia. Rationale. Clients with spinal cord injuries at the cervical level are at risk for autonomic dysreflexia, a potentially life-threatening condition characterized by severe hypertension. Monitoring for signs of autonomic dysreflexia and implementing prompt interventions are essential to prevent complications. Question 10. A client with a suspected hip fracture is scheduled for a hip arthroplasty. Which type of hip arthroplasty involves replacing both the acetabulum and the femoral head? A. Hemiarthroplasty. B. Total hip arthroplasty. C. Partial hip arthroplasty. D. Hip resurfacing. Answer 10. B. Total hip arthroplasty. Rationale. Total hip arthroplasty involves replacing both the acetabulum, hip socket, and the femoral head with prosthetic components. This procedure is indicated for severe hip arthritis or fractures involving both the acetabulum and the femoral head.